about this Echo session. I'm Rebecca Buller, and we're here at the Wayside Recovery Center, and it is the Women's Services Echo. And what I want to start with is introductions. So let's do the people in this room first. I have, I'm going to say Jessie Everts is here. You can't see her, just her hand. Jessie, do you want to introduce yourself?
Sure. Vice President of Clinical Programs at Wayside.
And we also have James McMurray, who's here, and he helps us with all of our technical needs. There's James. And Lucia, go ahead.
Unmute it. Don't unmute yourself.
You can just speak into this.
Hi, everyone. I'm Lucia. I'm the Education Prevention Coordinator at Wayside.
And then let's go to Heather. Will you unmute yourself and introduce yourself, please? Heather, can you hear us?
She might just be.
Sorry, it took me a minute to get logged in.
That's okay.
Can you hear me?
Yes. Will you tell us a little bit who you are and where you are?
We also do Suboxone and Project Echo. So yeah, did our training with some of your people.
Great. Well, welcome. Let's head over.
Thank you.
To introduce yourself.
Yep, this is Katie Stengel from CHI St. Gabriel's Echo Program Coordinator.
Hi, Erin Foss. I'm one of the RNs that works with the program.
Wonderful. We'll make sure we get Erin Foss on our list. Let's go to B. Kepler. Can you introduce yourself, please? Hi. B. Kepler? Okay. We'll come back if you want to introduce yourself later. I am so excited today to have Anne and Cheryl here from Mothers First. And we're going to first ask that you each use the chat box to just tell us again who you are and who's in the room with you so that we can keep track of who's been here and be able to share information with you in the future. And then I think we're just going to go ahead and get started. So use that chat box. Just let us know who's with you in the room and your organization. And I'm going to turn things over to Anne. We did send out the PowerPoints earlier this morning. You can watch them on the screen and then know that you also have them in your inbox if you haven't already printed them out. Go ahead, Anne.
Great. Hi, everyone. I'm Anne Eichmeyer, and I am the supervisor at Mothers First. And I am here with our public health nurse.
I'm Cheryl Hansen with Mothers First.
Great. If we just want to pull up the slideshow, I think that'd be great. Sure. Yeah. I'll get started here. Mm-hmm. There it is.
Then you can just click through.
Wonderful. Okay. All right.
Okay. Well, as we're starting to do this presentation and we were looking for history, and it turns out we have a banner here. We've been doing this for 30 years in some iteration. So the goal of Mothers First has been to help obviously women, but families with prenatal nursing, chemical health, and case management services. And basically using family strengths. Sobriety is always a bottom foundation that we want to work towards, and promoting maternal health to then, to spread to families and the children. And a lot of times the strengths that we're basing our assistance on is resilience and survival skills that our clients have learned, probably not news to lots of you.
Mm-hmm. So I'll talk a little bit about how women typically get into our program at Mothers First. And so historically, a lot of the referrals that have been made have actually come through the child protection system. And so often mandated reporters, and this might be a clinician or a child protection worker or a school, will actually learn that a woman might be pregnant. I should click to the next slide here. And also find that she is using, and so we'll report it to child protection. And then child protection, because when a woman is pregnant, the baby's not here yet, so they can't open the case, we'll do what's called like a service request for Mothers First. And so we get some referrals directly from child protection, opening up their services into Mothers First that way. And then we also take referrals directly into our program too, so you don't have to go through child protection. It used to be that the phone number that you called rang to the child protection line, and certainly some people still call the child protection line. Now it rings to our desk, and so we actually are able to get women into our program. Our case aide is there Monday through Friday from about 8 to 4:30 and answers phones and returns voicemails, and is able to collect the information needed to get that referral. And then we work hard on reaching our clients. Obviously, when referrals are made, we sometimes struggle to be able to engage and get in touch with the individual who's referred, but we will send a letter, we do phone calls, and then we also will drop by an address if there's one available. We try to kind of continue to engage them for at least 45 days is sort of our rule of thumb. And hopefully, are able to get in touch with them. And then another thing that I really want to emphasize is that we also welcome self-referrals. We encourage, all of you who might be working with women who are pregnant, who could utilize our services, to call themselves and initiate the call to us. And really want to kind of destigmatize what it means to get services through Mothers First and be able to support them in their treatment. And so if a woman were to do this, it'd be similar. The case aide would gather the information and then ideally on the phone with them, schedule their intake with the social worker. And then, of course, the eligibility criteria for Mothers First. So Ramsey County residents is, we're a Ramsey County program, of course. And then current use, or it can be a history of substance use disorder. And then is pregnant or had a child within 1 year from referral. So sometimes we get referrals right after a baby is delivered. And then I did put up there that exceptions can be made to this. And we'll talk a little bit more about this, but we have continued on with women longer than that first year after having a baby, depending on the circumstances. But we really want to focus on the pregnancy and then delivery and that first year after birth. So.
These little dots are representing who is in Mothers First. Anne didn't want to be a dot, so Anne is not included on our diagram here. But she's kind of the glue that holds us together. And you can see that it's client-centered, and we all have different roles, different specialties to provide different information to our clients and also to each other. I think working together, it's kind of the old working together is greater than the sum of the parts. And so I feel like our opportunities for consultation, getting different perspectives, getting different suggestions, I feel can be is very helpful, supporting our clients and each other. And then sometimes at the end of the day, we're surprised by how much we accomplish. So, and so you can see on here, we have 3 social workers. There's 1 public health nurse. There's our case aide that was mentioned by Anne, and then the peer recovery specialist, certified peer recovery specialist. And so that's our little band, our team that works together for Ramsey County clients. I was going to tell you a little bit about what each do, and I'm not going to read it to you because you can read it, but obviously 3 social workers, again, the underlying chemical health is kind of our mandate. And so in addition to helping clients get treatment, find treatment or remain sober, or help them to decrease their use, we also look to help them with referrals. Sometimes this amounts to hand holding, and sometimes it amounts to waiting on hold with clients. And a lot of times with clients, and I think you'll see this in our case study, can be feel really overwhelmed and sometimes just need to actually have that parallel play, if you will, or the adult parallel play version of being with them and doing what they need to do to be successful. Sometimes we go to court with our clients, being a support in court, and an advocate at different times. And I guess I just wanted to reiterate that our social workers truly are separate from child protection services. Although we're Ramsey County, sometimes people think we are connected, and we only speak with child protection with client permission. And we do coordinate with them so that we can help in that area. I'll try not to stay on. The next. Sorry, public health nurse. I could talk longer about this. So I'll try to be brief here, but there's one of me. And so there are criteria that we kind of start with, basically, because obviously some of our moms have been parents before and may feel that they prefer not to work with the nurse. But if it's a first pregnancy or a high-risk pregnancy, or if there are maternal medical issues, sometimes mothers are diabetic, or if they have not received prenatal care and need to get connected. Those are some of the things that I am charged with helping our clients to do. Also, kind of continuity between their clinic, sometimes being a bridge to public health nurse care after, so that's more long-term. Helping clients utilize WIC, get to WIC, pick up vouchers and so forth. Sometimes I translate medicalese, I call it, if I'm attending an appointment and the person looks a little confused. Maybe we have a conversation or I do some drawings. My drawings of different things are well known to my clients and sometimes appreciated, sometimes not so much.
Your colleagues.
Let's see. Also, I guess other resources. I've tried to introduce doulas, and because there are good results with doulas, and so that's on my list this year to kind of increase that, so that we can utilize those community services. I also see myself as an advocate. Sometimes I think it's hard for our clients to speak on their own behalf, and I want to encourage them in their appointments to ask follow-up questions and ask for what they need. And I guess those are kind of the main things. I do often go into birth control, different options, and also dispelling myths about when you can get pregnant. You might be surprised. Many people have that question. The next person on our team is the case agent. So have you? Thank you. And the role of the case aide is to support the team. First contact when the calls come in, so hopefully makes that connection, and then begins the process to open the case, and makes the first appointment for the person who will then do the intake in person with the client. So there's client contact as well as administrative tasks, making the intake packets, and also we do supply some different equipment, strollers, wipes, papers, different things, and our case helps with that, also with delivering those to clients. So there is client contact. Our peer recovery specialist is the next person on our team. And I think that's a really important role. Not that we all aren't important, but I think the modeling is just invaluable to our clients who work with our recovery specialists, because they come from a different perspective and can truly relate to our clients by having had their own personal experiences. And I like, or I find this helpful, that they address also the chemical and the mental health aspects of care in a very unique way. And I see them as they've talked to me and I come to understand their role, that they do a lot of coaching, and maybe our clients have not had a lot of previous role models, or are not kind of used to creating order out of chaos. And our peer recovery specialists can help with development of skills, whether that's coping skills or social skills or parenting kinds of issues. I think they see that person as a valuable person who can really appreciate what they are bringing because of their history.
And I would say, kind of going off of that too, we recognized how wonderful it was to have peer recovery specialists, that we actually have a grant now that works with Minnesota One Stop for communities to do some contracted peer recovery services. Specifically, this is the grant that was specific to opioid use disorder. And so earlier when I said we can be pretty flexible about our eligibility criteria, if the history of the woman is that she has opioid use disorder, we're able to refer to these services for all women who are parenting. So not just if they recently had a child or are pregnant. This is new for Mothers First. We started this contract, I believe was within the last month that they really got up and going. And so we're working with them right now and getting referrals to them specifically for our clients who have opioid use disorder, and they're able to do a lot of kind of parent coaching and mentoring, as well as assistance with the child protection system. And then they're also doing some parenting groups starting in the new year. So we're looking forward to that. And then also we subcontract with a housing service, because we find that one of the number one barriers for our clients is housing. And we subcontract with Solid Ground for a limited number of clients. Of course, it's always full, but we've got approximately 9 apartments with them. And we work really closely with them. They have a housing advocate on staff, as well as parenting support and a bunch of different groups. And so we'll do collaborative meetings, and their housing advocates attend our staff meetings every couple of months, and we attend one of theirs every couple of months, just to really make sure that we're providing coordinated care around the clients that we share, which we found to be quite successful. So, yeah. Okay. And now talk about one of our clients.
And this client actually is coming back because she was first presented, I think, last summer when she had just come on. And so I know sometimes when I see case studies, I don't know how they turn out. So we wanted to let you know how this one turned out. And just to give you a little bit of background, let me see. She was 29 at the time, with 2 children who were not in her care, and had been using heroin with the significant other, her partner, who was the father of the children. The children she became involved with Child Protective Services during that time that she was using, and there were concerns about neglect, and so she did go into treatment. She was in Suboxone, receiving Suboxone, ultimately because she discovered after her referral to us that she was 5 months pregnant. So she was living in transitional housing when we first met, and then was going to move on, hopefully to more permanent housing. And that was one of the things that we helped her with. I guess what I would say is that initially her goals had to do with family reunification. She wanted to be independent and self-supporting and live independently with her family and have her children return to her. Through the last year and a half, or how long she's worked with us, things have changed and evolved. Of course, her sobriety, which she's been able to maintain with the help of the medication supported treatment, was to stay sober, and she's done that. She's had ongoing UAs. She's been in court with Child Protection with their case plan. She's been working with them to do the things that were necessary to reunify her family. And so the case management that Mothers First has been able to offer complements what is offered also when she moved to Solid Ground, which is the housing piece. Maybe just an aside here, but I counted up how many people were involved in this client's life. And then on a low end, just the one-to-one Mothers First staff, Solid Ground staff, Child Protection, court, judge, public defender, her extended family, the people she gets UAs from, 2 teachers at school, visiting nurses that came to help her with dosing her child who was in need of the NICU right after because of the withdrawal from the Suboxone, multiple hospital staff, when she went to visit the baby, the doctor, the midwife. So that comes out to be 17. And then she's also participating in groups, support groups and therapy. And she also has new neighbors in her apartment complex. So I guess the reason I point that out is that it's not just us helping. There are a lot of people around her that are helping and that are supportive. And yet it can be really challenging because it can be overwhelming, the number of people involved in her life. And so I think over this past year and a half, some of the people have left. Child Protection has now left, and she maintains the things that she was doing in her case plan, while hopefully other people are going to be bowing out as well, and when she needs less support. Let's see, I think she had a couple, I was going to say it wasn't all smooth for her. There were a couple unexpected things. One was 2 positive UAs, which required a doctor letter to help the court understand why her personal medications would have made positive UAs. But that was very stressful, and I think we were able to support her through that because it was very traumatic, saying, I didn't use, and we needed to believe her and help her get the information she needed to make that case for herself. And I think the fact that the baby was eventually able to come home, and the nurses initially came out to provide the Suboxone, help her learn how to do it, to wean her new son off of the medications. I think that was a big step for her. She had requested at one point a medical lockbox, which was something we were able to provide her so that her little busy children weren't able to help themselves. But that also helped her to have a secure place to keep the medications for the new infant, which I think was kind of concern to her. And so she came a long way and accomplished her goals. And although she's still working on things, she really is doing quite well and independent in her apartment.
All right. And I guess kind of coming to the end here, I don't know if anyone has any questions, maybe in regards to the case that Cheryl just talked about, or Mothers First in general, but would like to open it up.
Will you say again how she was referred to you, that particular case? How did she get in contact with you?
I'm trying to think because I came in after, but I think it was the child protection piece, because the children had been placed with relatives because of the use. There was neglect that was reported, and then they followed up on that.
Yeah. We often get referrals from child protection if there are other, kids that might be in the child protection system, and then the woman is pregnant or becomes pregnant. We'll often get a referral that way. Yeah.
Maybe a question related to that is, as treatment providers, we're often the ones who have to report prenatal use, and women are often really scared about that and think it means that automatically they're going to have a child protection case. And so we try to explain, but what's kind of the short explanation of how we can talk to them about the services that Mothers First offers and the benefits of doing that, so that they feel a little bit less scared about what happens when something is reported.
Yeah, I definitely, I think this is a big passion area of all of us, is that we really want to support women in becoming, healthy mothers and have healthy families. And so I think just to really reiterate that, and to, know that they're not going to face a bunch of judgment when they come to us. Obviously, we can't promise whether or not child protection will be involved, or if they already are involved for other reasons, but we are different than child protection. And I think if their goal is to have a healthy pregnancy and have a healthy, family, that's what our goal is for them too. So that's how I would.
How many of your clients, as a guest, do you think are clients that you've worked with before that are coming back?
That's a good question.
Is it common or
it's not, I would say it's not uncommon.
It's not uncommon, but I wouldn't say it's the majority either. I'd say the majority of the clients we work with are new cases that we've never worked with before, but we still see, some people who come back through our program, maybe in a different pregnancy, that type of thing. Yeah.
And we find sometimes that word of mouth or whatever, and we'll have somebody's cousin, which, we try to assign differently and maintain that confidentiality. But they do talk to each other.
We like it when we get a positive referral. Like, I heard about your program and wanna, I think that always is a nice way where it's not, someone reported me and sort of this punitive action of Mothers First is involved, but Mothers First is here to help. So
we do often say, just to remind people that we are a voluntary service. Now, sometimes other agencies will insist on participation of their clients with us, but we are voluntary. And if somebody chooses not to work with us, it's not, there's no mandate. And hopefully, and I think this happens more often, that if we can talk to them, and if we can engage them and kind of let them know what we're about and what we can maybe help with, that goes a long way to then kind of reassuring them and helping them take that step.
Is it frequent that you are the ones who connect a woman to treatment or to MAT, or is it usual that they already have that in place if they need it, or how often does that happen where you're the referral for that?
Yeah, it goes both ways. Our social workers, so every client who comes into our program is assigned a social worker, and all of our social workers are LADCs. And so we've found that people will often come into our program looking for Rule 25 and looking to get into treatment. And so sometimes our social workers will actually schedule having, an intake for our program and then a Rule 25 right after the intake, just because that woman is motivated to get into treatment. But then we also see, we get referrals a lot from OB-GYN clinics and places like that. And so they might already be connected to some type of care but tested positive, and so they might not be at the point of wanting to access treatment, immediately, but working with us and sort of, talking about what it looks like to deliver a healthy baby, I think is our goal. So.
I had a question about capacity. So you work just with Ramsey County residents. Are you ever at capacity? And how much is that? I mean, you know what I mean? Like, it's a small circle of people doing this work.
Yes.
And so I'm curious about how many are on your cases you have at a time, and when do you we can't do anymore?
Right. I think, I appreciate you asking that question. And when we were talking about the eligibility criteria, that's really where we've kind of narrowed it to that first year. Because if we were to just serve all women who are parenting in general and have substance use, I mean, that really can add up quickly. And so, we still see that we're having higher and higher caseloads, and I'm really trying to figure out how we can utilize some of these contracted services and other supports in the community to get, people other connections. Right now, we're actually one social worker down, but we have a new one hired. She starts on the 17th. We're very eager for her to start. I think our caseloads are at about 60 each for the social workers. And so that will be, it'll be nice to have her start. We'll just put it that way. Yes.
And do you know of other counties with similar programs?
Yeah, so I know I moved here from Seattle in June, so I'm new to Ramsey County, but I've learned that Hennepin County has Project Child, which I think does some different kind of, programming too. I think they have a lot of groups and that type of thing, and they really focus on pregnancy as well. And I'm,
I think Dakota has similar, but I don't know a lot about that program, to be honest.
Yeah.
Okay, but just a couple.
I mean, there are certainly a lot of, treatment, or not a lot of treatment programs, but treatment programs that work with women who are pregnant, but not necessarily through, it's not county based always. So what we found.
One other thing, just to go back to your question, one thing that is part of our grant, because we're grant funded, and so one of the mandates is to try to work with fathers, and because of the caseloads and so forth, it's been a little bit hard to do that, but that is one of the things that social workers will often offer if a partner is ready to have a Rule 25 and go into treatment. That is, I think that's kind of an important piece, because if they're going to be together, that's going to be such a big deal.
Absolutely.
So that's been another.
Yes. Even though we're called Mothers First, we still support fathers.
Yes. Mothers, kids, and them. In order.
Yes.
Are there any other questions? People participating? We've got a couple of folks that looks like Bethany is on, and from up in Duluth, Fond du Lac. And I'm not sure who C. Baldwin is. C. Baldwin.
Maybe put your information in chat if you haven't already, and you can ask questions, either unmute yourself or write them into the chat box, and we can read them here too.
Well, what we'll do is, do you have anything you want to add? Because we don't have to sit and look at each other forever. We can move on with our day. Did you have anything else to add about Mothers First or the case? So that mom is doing well, and I think that's a good place to leave it. It makes us feel good about the work you do and what's possible.
Yeah, I think in coming here today, I anticipated maybe speaking to the choir, because I think that we share commonalities with the other people. But I think it is nice to hear that sometimes what we do makes a difference.
Yeah, it's really important. I think you had asked before we got started, we do record all of these echo sessions so that if anybody on the session today knows of someone else who might want to learn more about Mothers First, by next week we will have posted this in our archives on the waysiderecovery.org website under the professional tab. And you can see any of the echoes that we've done there. They're not edited, they're not pretty, but everything's there. And as well as the PowerPoints and the agenda. So we just want to let you know that you do have access. Lucia will be sending out evaluations to folks afterwards. And please, if you've got colleagues who'd like to sign up to get the invitation, let us know that, or just provide Lucia's email address. But you can also just send us a note, and we'd be happy to do the outreach. If you have a topic that you would like to have us do some legwork for and find folks anywhere in the state, it doesn't have to be based in the Twin Cities, because with this technology, we can all talk to each other from all over the state. So if there's something you wanted to know about, or something that you have questions about, or something you're doing that's amazing and you want to share it, please let us know, either me or Lucia, and we'll try to create a place for you on our Echo schedule. Lastly, we don't meet again in December. We're taking the third Thursday off because of all the end of December, end of year hectic time is for many families. So we're going to just take that time off, and we will regroup and meet again on January 3rd, where we'll hear from Out Front, Minnesota. And we're looking forward to that as well. And we'll be having conversations about LGBTQ community and how that relates to some of the substance use disorder work that we all do. So thank you so much for being here. And if there's nothing else, I'm going to set us all free.
Thank you.
So thank you so
Yeah,
much.
thank you.
Thank you.